Hello, I am Miranda Bohnenkamp. This is my presentation on my experiences to becoming a Nebraska Methodist College educated citizen. Throughout this presentation, I will relate experiences in which I have demonstrated the educated citizen goals, while relating them to how I plan on implementing those into my career and personal life in my journey to address child abuse in our community. I have a passion to protect our vulnerable population. The reason and personal connection to this public issue is I believe that child abuse is not being addressed to the extent it should be to break the cycle of abuse. Peds rotation at Children's Hospital, I cared for a boy who wasn't able to speak and spent most of his time in a poppy bed. He wasn't able to say a word, but every time I cared for him, he would stare at me, and it felt like he was telling me everything that was going on inside his head. So I would ask him questions, and sometimes I would get a noise or some kind of response, as if he were answering me. Caring for someone at such a deep level, you are able to find the better parts of yourself. Once I seen a graphic of a nurse holding someone's hand, and the quote on the picture said, "The best way to find yourself is to lose yourself in the service of others." To remind myself that dignity is something every human deserves. My hope is that when I need little reminders, a patient will come along that I can find my purpose in. The day I cared for him, I found a part of myself I didn't know I was, and I will be forever grateful for him. There is simply nothing more important than a child's innocence that can be taken away with one single touch. As a reflective individual, I know that there will come a day when I become tired of fighting for injustices in our world, such as child abuse. I will use this experience to remind myself why I wanted to be a nurse and why I keep fighting for our most vulnerable humans. Another reflective individual experience I had occurred in my personal life while I was talking with a friend. She told me information that shocked me regarding issues that were occurring in her family's lives. Given the severity of the information, my reaction and response were not something that I was proud of. As a reflective individual, I want to be able to handle difficult conversations with individuals and be able to quickly reflect and respond in a supportive, logic, and empathetic way. After our conversation, I had left for the night. I thought about what we had talked about and how I reacted. I know it was not what I expected out of myself. I thought about ways to change how I responded to hard conversations and how to show support to others going through difficult times. The next time I seen my friend, I told her that I was sorry for not knowing what to say in that moment, that I was proud of her for going to the lengths she is to protect her children, and that she did the right thing by coming forward and saying something. Moving forward, I will use this experience to know how to provide support and encouragement to my peers and families that I work with. By knowing how to react to situations like this, I will give individuals who come forward the reassurance that is needed when it comes to abuse. Rotation, I was at the Lydia house. There I worked with a mother of 3. She recently had a new baby that she had planned on giving up for adoption to a family friend. However, because the baby was born with Down syndrome, the couple did not want to take on the burden of caring for a child with special needs. The mother then looked for adoption through an agency. Unfortunately, the agency needed father's consent and he refused. So the mother had to keep the baby that she planned on giving up. The father spends most of his time in and out of jail. All 3 of the kids were under the age of 3 and one of them having multiple provider appointments every week. I was not sure how she would handle all the things needed to do to get out of the shelter, and I was not sure if adoption was something that she still wanted. And I didn't know how to ask without overstepping and still being sensitive to her feelings. As I thought about how to ask her if she still wanted to pursue adoption, the only way I came up with was to be direct and just ask. So she told me not anymore because the baby is 3 months old and she's kind of attached. As she continued to tell me more about her story, I was concerned that all the tasks she had to complete was a lot for one person to handle. As an effective communicator, I wanted to give her something to organize all of her tasks that she needed to complete to provide for her family. We worked together and created a to-do list with all the tasks she needed to get done. I used my critical thinking to generate, connect, and organize ideas in a written manner that was appropriate for the situation. I believe that I have gained through my nursing program has guided me in ways I didn't see they would. I helped her by giving her ways to manage all aspects of her life. I provided her with a practical tool for her to manage her time and duties as a single mother of 3. Communication I displayed with her was concise and easy to understand, which in this situation was adequate. Throughout my nursing journey, I found that direct communication is the most effective way to communicate with clients. Using direct, effective communication, I will talk to parents about stressors they have at home, how they are effectively handling the stress. I will communicate to them the importance of having a plan if stress gets too high. I will communicate to my peers by using written language in the form of an infographic and post them in the nurses' lounge on how to use direct communication when talking to parents about the prevention of child abuse. At the start of my senior year, my grandma was admitted to the hospital. She died 10 days later. In those 10 days, I learned what it's like to be on the patient side of healthcare. The messages from the doctors to my family that was allowed to go to her room would often contradict what the nurses and the tests would tell me. I began to doubt myself and my soon-to-be career. So even though I didn't understand why the doctors would tell my family one thing while everything I seen and heard would draw a different picture. Because of what happened to my grandma, while I was in my ICU rotation, I paid closer attention to the conversations between healthcare staff and patients. Since I understood discussions between medical professionals, I started to gain insight on how doctors speak with patients. As I put those pieces together, I realized that one of the most important parts of my nursing career will be my ability to teach my patients. The tasks that I plan on engaging to keep my knowledge up to date are evidence-based practice, new research studies, and collaboration with my peers. Another part of being an effective communicator is the nurse's ability to question the doctor's actions and relay the concern in a way that is not condescending but provokes professional collaboration. So far in my clinical experience, I have often seen nurses work hard to build rapport with patients and the family members, to have the doctor come in and turn the nurse into the villain within a few moments of their conversation. This situation can be avoided if the nurse can provide enough education to the patient and the family, and they will ask appropriate questions of the doctor. By continuing to seek research on current evidence-based practices on child abuse, I will be able to effectively communicate with my peers in educating them on the different signs to look for when taking care of children. Also, I will have the knowledge to be confident when I am talking about abuse with others and will be able to answer questions. Delivery rotation, I cared for a Middle Eastern couple. When I entered my patient's room for the first time, the first thing that came to mind was it's going to be a long night because I would not be able to relate to my patient. When I left the room, I gathered my thoughts and changed my attitude. There were many differences between her and myself, but there are still so many parts of us that were the same. I have been where she is once before, giving birth for the first time and fearing the unknown. Next time I entered her room, I cared for her as if we had grown up together. I learned by reflecting on my biases, acknowledging that they were there, and changing them. I was able to have one of the best clinical experiences I've had. As a change agent, my ability to acknowledge my biases and provide culturally competent care has greatly improved, and I have shown growth in my ability to change my judgment, biases, and attitude towards those who may not fall into the same category. The goal I have for myself is to eliminate first impressions altogether. Even if the image is good, I think that the only way to stop the negative biases is to eliminate all biases. Before meeting a patient, I will take steps to clear my mind and remember that every patient is a blank sheet of paper. I cannot assume that this person will be good or bad. Also, I will not place biases on individuals from information on their EMR. I will use this to change the views of cultural norms and not place judgment on other cultural practices while I provide education about the laws that are in place to protect children of all cultural practices and all walks of life in the nursing practice when it comes to child abuse. My most challenging subject, but heart failure has always been incredibly fascinating because my grandmother and my father have AFib, so it drove me to want to know more. One day at clinical, I had the opportunity to watch a heart cath, and in those brief moments when the contrast flows through the vessels on the heart, I fell in love. I was looking at RN positions online, and there was a new grad position for the cardiac unit at Methodist Maine. So I applied. I got an interview. Going into the interview, I thought about what an HR manager said to us in class 1, that we should probably study information if we're applying for a specialty. Well, to be honest, I have studied the life out of the cardiac system and it's still my weak point. However, I have confidence in my clinical skills, ability to learn, desire to understand the why of almost anything, and confident that given the chance, I can be a great cardiac nurse. At the interview, the service leader asked why I chose cardiac. I took a deep breath and said, well, the heart is fascinating to me, but it's my most challenging subject. I told them why I went into nursing and that I never thought I'd make it this far. I told them I lost both my grandmothers to heart disease, about my struggles with heart medications. But I went into the interview being confident in what I have to offer. After the interview, I figured that I wouldn't hear about the job for a few weeks or so. But during class that week, the HR staff member called to offer me the position. I giggled to myself and accepted the job position with a massive smile on my face. Over the past 4 years, I have watched myself and my peers put ourselves under so much pressure that we must know everything or we won't be good nurses. We continuously compare ourselves to each other in our cohorts, thinking that we will never be as good as the individual sitting next to us. We need to change the thought process of nursing. We are a team, and that should start in nursing school. We need to stress less about exams. Students need to feel confident in their knowledge and learn to be okay when corrected because we are learning. By being an effective change agent, I will use what I have learned through this situation by believing in my intuition, going with my gut, and being a transparent individual. As I continue my journey to help end child abuse in our communities, I will teach individuals to use their intuition to seek justice for child abuse victims. I will do this by speaking at community events, making infographics, and spreading the word about advocating for children who are victims of abuse. This is my presentation on my experiences to becoming a Nebraska Methodist College educated citizen. Throughout this presentation, I will relate experiences in which I have demonstrated the educated citizen goals, while relating them to how I plan on implementing those into my career and personal life in my journey to address child abuse in our community. Thank you for your time and thanks for watching.